Okay, I have 2 o'clock, so we have a little bit of business to talk about today. A couple things to run past the health board, and then we'll be on our way. So for those of you who are joining us on YouTube, my name's Amy Leone. I'm the city manager in Yankton. This is the City Health Board, and I'm joined by health board members Dr. Mary Milroy and Mayor Nathan Johnson. And also we have ex officios of the health board, Dave Mingo, Community and Economic Development Director, Brad Beese, who's our Community Development Manager, as well as Jason Foote, who's Commander for Yankton Police Department. Ross Denherter could not join us today, but I have visited with him a little bit. So I guess where I think we should start, I have kind of 3 items, but I think where we should start is looking at our metrics for today and talking a little bit about metrics. We do have a commission meeting tonight, so if we take any action, we can ask the city commissioners to do the same. The health board recommendations are on the agenda. So good news to report and some other news to report, I guess, again this week. We'll start with our hospitalizations. There is hospitalization right now. There's 2 people hospitalized at Avera Sacred Heart with COVID-19. That's still under our sort of metric for the goal. Just not exactly where we'd like to be. Of course, we'd like that number to be 0 across the board, but there was in our meeting today with emergency management, there was reported a death in the county over the last week. So we're not using that as a metric, but just so the public's aware. Case numbers, we haven't ever gotten to that goal. We got close. We got down to like the 30s and 40s for cases, but we have never gotten to our goal of 25. We are lower than we were the previous week. So we went down about 10 cases there, 64 active cases. So it's good we're going down. I'd like to be further down than that. Vaccinations, it looks like here on our vaccination ring that we have 36% that have received both doses and 16% of our population that's received at least 1 dose. So that's about over half. That's 52%. That's great. This does not include, still, we do not believe it includes the federal vaccination program. So I would add another 10%, really, is my gut feeling. And I don't know if our vaccine officials would say the same, but that's my guess. So, I mean, I think that we're at a point too now where vaccination is prolific and people will be able to, if they're age eligible, just be able to go and get it and not have to wait a long time. So it's open to folks now. And I think we're in a good position in terms of being able to administer vaccine. So I don't have any real recommendations based on that for the commission, other than, you know, we want to see the 2 metrics on the right continue to decrease and that metric on the left increase wherever it went, however it can. Any comments or recommendations from either you, Dr. Milroy, or Mayor Johnson?
Just that I think that we should all be really pleased with the rate of vaccination and really thank the community for stepping up and really getting the vaccine as soon as they can. And I know that the age limits are being expanded. And so I see that number continuing to increase, which is certainly a very good thing. Also, Amy, I agree with you. I certainly think that the number that we're seeing is probably a low estimate, and when we would add in the number of vaccinations that are being done at some of the other facilities, such as the pharmacies, you know, that's a significant number of the population that will have had the vaccine, which is a very good thing. I would, again, just caution the community that our active case numbers are still there. They're definitely still there, and that safety and caution is still the best way to be. It's concerning. There's 2 hospitalizations. I think we had all hoped it'd stay at 0. And hopefully, if we continue our safety precautions and our vaccinations, then we can get that number back to 0. I don't have any specific new recommendations for the commission, however.
Yeah, what I'm hearing is that the average age of those who are hospitalized has gone down quite a bit. So I think that shows 2 things: that the fact that a lot of our more elderly population have been vaccinated, it's working. And fortunately, we're not seeing them being hospitalized as much, but still for the younger population, it's still very important that you get vaccinated so that we can get those hospitalization numbers down to 0. I know with vaccine clinics, what I'm hearing across the state is that a lot of locations have more vaccine doses available than they have people signing up to get vaccines, and that's true in Yankton. So like everyone else here, I just want to encourage people to get vaccinated. If you're one of those individuals who was hoping for the 1 shot, the Janssen, Johnson & Johnson, A Very Sacred Heart will be hosting a walk-in clinic this Thursday from 4:30 to 6:30 p.m. at the Yankton Mall. So if you want to show up, it'll be on a first come, first serve basis. And especially for farmers who may be worried about spring planting and where they'll be in a month, this may be a great option for them.
Ex officios, if you have something you'd like to add here on our metrics, I'll have you turn on your lights and your cameras. Otherwise, I'll wait for comments here from you till we get later on to our business. Hi, Mr. Mingo.
You second otherwise filled the bill for me. I don't have anything to add to the metrics discussion at this point, so I'll wait.
Okay, thank you. So the next little piece of information I guess I wanted to share with you, Dr. Milroy and Mayor, is that tonight at the City Commission agenda, I'm going to be talking a little bit about just our organization and where we are in terms of vaccination and protocol. I'd like to get the Commission's response as to whether or not they believe we're doing things the right way. Many of us, because of our roles in the community, are past our 2 weeks time frame, so we're considered that fully vaccinated population. So I'm looking to step back our protocol a bit when it comes to some of the safety precautions that we've been having. So recommending that the Commission return to full in-person meetings, still utilizing masks in cooperation with the school district policy of wearing masks, at least through the end of that school year. And perhaps at that time, we know a little bit more information or we see more vaccination occurring, but that we come back together physically using 2 social distancing and our wash in, wash out policies that we've had. Same with staff. However, in cooperation with the CDC guidelines, if we have 2 staff members who are fully vaccinated and past their 2 weeks, allowing that interaction to occur, first of all, physically connected because we've stayed separated as much as we can, but then also allowing the mask to be an option for fully vaccinated people or folks that, you know, have indicated that they are not going to choose to have the vaccine, and understanding that many of us have. So I'm going to talk to the Commission about those recommendations. I know that we don't know the future here entirely with COVID-19, so moving the dial, I guess, counterclockwise backwards might mean we have to move it again forward and change. But I think that, you know, the vaccine gives us some opportunity, at least for some time, to do some of those things. So just wanted your thoughts and comments about that and how we're going to manage our own organization. We certainly aren't going to dictate how anyone else does handles their protocol.
Yeah, I think that sounds reasonable. It sounds within CDC guidelines. So I don't see a problem with that recommendation.
Yeah, I agree.
Okay. And please, ex officios, if you have something to add, again, you can do that. Or we'll just move on to sort of the final topic that I wanted to visit with you about, and that is our meetings. If there is any recommendation from us today, perhaps it's this one. I still like the staff tracking these goals and sending these metrics out. I'm wondering if we could move to a once a month meeting, if the commission's okay with that. Just not a lot has changed for us week to week, especially the weeks that we don't have a commission meeting. I'm okay with doing that. We can always call a meeting if something were to happen unforeseen.
I think that is reasonable. We haven't had a lot on our agenda since things have been relatively stable. I would ask, however, that how you've been emailing us the metrics every Monday, that would be very helpful. And so I would ask to have that continued to be mailed to all of us. And then we can take a look at it. And if there is something of concern, we can notify you and schedule a meeting. But otherwise, I'm quite good with once a month.
When you say once a month, are you thinking we still need to meet once a month, Dr. Milroy? Because I think Amy was talking about us not meeting unless there's reason for us to meet.
Oh, I thought she said once a month, but I maybe misunderstood.
I did say once a month, but that's up for discussion. That was just a suggestion.
Okay.
Mayor, if you feel we're okay not meeting and just doing the metrics.
I think where I'm at is I'm okay with us monitoring things through the metrics every week. And then if we see something where it's decided that we should meet and discuss further, then we would meet. Otherwise, yeah, it just seems like we've been in kind of a stable condition here where we're concerned and about the cases not going down as much as we would like to, and just encouraging people to get vaccinated.
Okay. Well, I will let everyone know after I visit tonight with the commission. I'm going to bring it up and say during the health board section of the meeting, say this was here are our metrics. We'll talk about those, and this was our discussion. Are you okay with us, or is there some lesser number of meetings that you'd be okay with? So I'll get back to everybody on the feedback there. The final thing that we should. Yes, Dave?
Sorry, I would just say the important factor there is it's not like we're just going to disconnect. We're we're still going to stay in touch with each other on a weekly basis. It's not like, hey, we're done meeting, it's all over. We'll stay in touch. The task force, the committee will keep working. We just won't use this forum anymore.
Yes, and that is a really good segue, Dave, to my final point, and that is that the health board is comprised of the mayor and the city manager, and then somebody appointed by the city manager, who is you, Dr. Milroy. And as many folks have heard, there's an election tomorrow, and our current seated mayor is up for election to the city commission. And first of all, everyone that can vote should go vote. But second to that, if the mayor is reelected, if the mayor is reelected to the city commission, it doesn't necessarily mean he'll be the mayor again. So whomever is chosen as the mayor of the 9 seated commissioners, that will happen, I believe, May 11th, I will make an appointment of the mayor, whomever that is at that time, to the health board, so that even if we're not meeting, we have that group in place if we need to, change quickly and have a meeting for these purposes. So I just want people to know that if we end up meeting and June and it's a different face, there's an understanding of that. So with that, I'd like to ask any comments from anybody or feedback. Mr. Bees or Commander Foot, anything you'd like to add?
Nothing from me.
Nothing from me as well.
Okay. Okay. Well, I think with that, I don't think we need any type of action other than the adjournment.
I can make that motion.
And I will second it.
All in favor, please signify by saying aye.
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 Opposed, same sign. Okay, we are adjourned at 2:16, and I will send these metrics out to the commission, and I'll bring feedback to all of you over email as regards to our meeting schedule.
Terrific. Thank you.
Thank you. Have a good day, everybody.